Greetings, and I want to thank you very much, Alex, for allowing me to come and be part of this fabulous conference. So my topic today is the perfect marriage, thermography and cryoablation. Plus, I'll be discussing my new book, Protect Your Breasts, Reduce Your Risk or Reoccurrence. My name is Ingrid Edstrom. I'm a family nurse practitioner of just about 40 years now, beginning to date myself here a little bit. And I also have a master's in health education, and I'm a thermography technician. So I want to say that I'm the owner and clinician at my two business ventures, Infrared Breast Health and the Proactive Breast Wellness Program, again in Eugene, Oregon. The information in this presentation encompasses my research, clinical practice, and professional opinions. For HIPAA compliance, all the patients whose infrared images are being shared with you today in this presentation have signed releases. The facts are, in the U.S., as other places, breast cancer is an epidemic. In the U.S., 1 out of 8 women will be diagnosed with breast cancer during their lifetime, which is estimated to rise to 1 in 5 in the next 10 years because the environment is getting so dirty. 1 in 39 women will die from breast cancer. 70% of all breast cancer diagnoses are less than 2 centimeters. Breast cancer is the leading cause of cancer deaths among women aged 40 to 50 years of age. Breast cancer is second only to lung cancer in cancer deaths among women, but what we really fear is breast cancer. So, do you know, this is the good news, only 7 to 9% of breast cancers occur because of inherited genetic traits. So that means that 91 to 93% of your risk is related to the environment, dietary, hormone balancing, stress management, thyroid and vitamin D, and lifestyle choices. So this is really empowering. So what are your breast health options here? Women need to know that they should be doing to reduce their risk of breast cancer or its reoccurrence if they've had breast cancer in the past. So now let's consider thermography, the Protect Your Breast protocol, and cryoablation. So you know that it's 100% safe, no radiation or radio waves coming at you. I have 2 high-end military infrared cameras that are FDA approved and cleared. I have 1 FLIR, and I also have a Spectron IR. It's completely painless. It detects inflammatory changes 3 to 8 years before the mammograms will see it. So it generally is able to find things about 3 millimeters in size for the high-end cameras. It may also identify skin abnormalities, melanomas, subclinical hypothyroidism, thyroid tumors, and failed root canals. So who needs thermography? Cancer survivors, pregnant nursing types, high-risk lifestyle, people on birth control pills or synthetic hormone use, dense breasts, large breasts, small breasts, fibrocystic breasts, which is 1/3 of the population, the prevention conscious, people that have had toxic exposure to herbicides and pesticides, family history that's positive that they're now worried, or people with breast implants and reduction surgery. So thermography is rated on a TH1 to TH5 grading scale. There's a number of points. The more points, the higher the number. So it's a TH1 and TH2s are normal. TH2s may indicate dense fibrocystic breasts with hormonal influences or estrogen dominance. TH3 is borderline or equivocal. These are the ones I'm most interested in because I can usually shift them back about 65% of the time in 6 to 12 months on the Proactive Breast Wellness Protocol. TH4 is abnormal and TH5 is very abnormal, so those will have the highest number of points. So the diagram shown here are changes in the cell structure and cellular activity. So when there are more cells producing heat, the infrared temperatures are higher. So breast cancers are actually very slow moving. They take 10 to 12 years to grow to the point where there can be a palpable mass, or they can be seen on mammograms, and generally I can feel a lot of the small ones at about 3 millimeters, 4 millimeters, and it's really very helpful with the thermography because you can see a little heat signature there, and then you can poke around and see if you can feel something, which then makes it easier for me to help to organize orders for ultrasounds and mammograms and MRIs and biopsies. So the infrared images can detect this temperature change prior to lump formation while there's still time to alter the inflammatory process. So infrared is considered the best risk detection tool available to modern medicine, which is really fabulous. So on the drawings on the bottom here, this is a normal milk duct cut in half. This is interductal hyperplasia with little extra cells, hyperplasia with atypia, so a few little extra cells here. These are taking oxygen and nutrition from the capillary bed, and these are the ones I'm most interested to try to get them moving the other direction. If these little abnormal cells keep going and going, you have DCIS or ductal carcinoma in situ. If it keeps going some more, you have invasive ductal carcinoma where it's broken through the membrane. These abnormal cells are releasing nitric oxide, which opens up the blood vessels to feed the tumor, and it's called neoangiogenesis. Here's a nice article from the American Journal of Surgery in 2008, and it shows that 58 of the 60 tumors were picked up with a 97% sensitivity, and MRIs are about 98% sensitive. So when I first got the camera, I was trying to figure out why it was that some people had normal scans and other people had cancers. This woman has an invasive ductal that's sitting over in here. So I started asking a lot of questions because I was a little confused as to why it was that people came in looking totally different. So what I discovered is the people that seemed to have the best scans had a healthy lifestyle. They were having an organic diet. They were on a supplement program. They had optimized vitamin D levels. If they were hypothyroid, they got thyroid support or thyroid replacement. Their hormones were balanced. They didn't have a lot of herbicide, pesticide. They were thin. They were exercising. So I thought, well, if I could figure out what's happening over here so that the people that were getting cancer, which were the herbicide, pesticide crew, the non-organic diet, imbalanced hormones, sedentary lifestyle, every last woman over here that had cancer that I was picking up that were biopsy proven later were also vitamin D deficient and hypothyroid, and those are things that we can sort of fix. So I thought that if I could figure out what these people were doing right and try to educate the people sort of in the middle so I could maybe try to turn it around so people didn't end up over on this side, this is how the preventative reduce your risk of breast cancer proactive program came to be. So here's a nice TH1 cold scan. It's done on a Celsius scale with the better cameras that also have a gray inverted palette. So dark blue is cold, light blue is warmer, greens, yellows, and oranges. So this is cold, nicely balanced, light and fluffy. So here is a picture of a woman that's 6 months pregnant, and the gals that are nursing also look very similar to this. So you can see this vascular activity in the lower breast scan due to the increased levels of hormones while she was pregnant or nursing. So you can see all this activity here. So the issue is if you're 54 and on too much Premarin with a tumor developing here with blood flow leading to it, that is not going to bode well. But for the pregnant nursing gals, this is what you're supposed to look like. Here's a nice normal TH2 scan. Again, she has these beautiful chromatic stair steps. So dark blue is cold, light blue is warmer, greens, yellows, and oranges. She has some muscle spasm up in here, so she needs an acupuncturist or a massage therapist. You can see that she's sort of light and wispy over here. This is what we aspire to be. This next woman I put in front of the camera and say, "Madam, you're not an organic eater, are you?" And she says, "How can you tell that?" And I said, "Well, you don't look like this." So since this is an organic eating vegan, she looks great. No bovine growth hormones in meat and dairy. She's wearing organic cotton. She's not spraying Roundup all over her picnic tables. And this is the typical American diet with drive-through McDonald's. Bovine growth hormones in meat and dairy, too much Premarin, too much estradiol, and not enough progesterone to balance it out. Too many xenoestrogens or estrogen mimickers or body burden in her environment. Excessive plant estrogens are driving this vascularity up in here. So it increases the vessels, and they sort of look like bowls of spaghetti. So the problem with the bowls of spaghetti gals, if you have a tumor developing here or a tumor developing there, you have the potential for tumor doubling. Whereas this gal has a 95% chance of never ever getting breast cancer. So here's another one that has a invasive ductal here on the left. It was undetected by several mammograms before she came to see me. So note the blood flow or neoangiogenesis that's coming down from the anterior chest, coming from the lateral area, and coming from up underneath to feed this. It's over here. She's also been doing some lifting. She has this tumor that's sitting here at 12. I ordered an ultrasound, sent her off to a surgeon. She was biopsy proven, and she has really dense breasts, and this was actually her first thermography visit. This gal has a TH5 severely abnormal thermography, again a first time infrared. So she has an invasive ductal on the left. It was undetected by several mammograms and ultrasounds in the recent past. The tumor is sitting over in here, so I ordered a biopsy, and it's a 5 millimeter palpable area, which was positive. And then you can notice the blood flow leading across to this area. The other thing is that she has a 2.5 degree nipple delta difference. So I always say that thermography is adjunctive. It's not instead of other sorts of imaging, but it certainly does look into the future, and I absolutely love my infrared camera. This woman lives on a mint farm, and you can see that she has a TH5 up in here, and this whole breast is warmer than this opposite side. She has these big gnarly vessels. So with mint and several of the other crops, they tend to aerial spray in between the crops. So it's actually her father-in-law has prostate cancer. The brother has non-Hodgkin's lymphoma. I also have a group of women that are equestrians, and they have horses, and they're using pesticide fly wipe, and they're patting the horse, grooming the horse, and you get these large quadrant vessels from these gals because it's absorbing through their skin. And then I have a whole group of people that are aerial sprayed that live next to clear cuts or live up valley in the Willamette Valley where there's a lot of agriculture, and they're coming across with crop dusters or on the back end of tractors. So consider the impact of your environment, your diet, lifestyle choices, hormone balancing, exercise, stress management. And later in the program, I'll talk a little bit about how you can protect your breast with a proactive breast wellness program. So now I'd like to introduce you to the exciting world of cryoablation to see through the lens of an infrared camera. And cryoablation is the future of breast cancer care. And I also have to say that I was previously a sales agent for both Sonaris and for IceCure for the Pacific Northwest region. So I've been involved in the cryoablation area since 2010 now, so I'm very excited about cryoablation. I'm now also a cryoablation nurse practitioner navigator. So cryoablation, the process, it uses extremely cold temperatures to produce targeted tissue necrosis or death of cancer cells. The necrotic tissue is resolved over time by the body and replaced with healthy tissue. Most common uses of cryoablation is kidney, liver, lung, bone, cervix, prostate, and now breast. Hallelujah. The advantages of cryoablation. So it has actually been shown to be more effective than traditional surgical excision, which is very exciting. So it has 100% complete tumor ablation within the ablation zone. It has a quick turnaround, a 30 to 35 minute, maybe 45 minute procedure. It can be done with an ultrasound in the office, which is ultrasound guided, so it doesn't cost a lot to add this to your office setup. It's minimally invasive. It conserves the breast shape. It's shown to not adversely affect mammograms or ultrasound interpretations in future, which is great. And you can also follow these gals with thermography, which is the perfect marriage, of course. Excellent cosmetics. 1 3 millimeter incision regardless of the tumor size. It only requires a little bit of local anesthesia. The patient is awake during the procedure. It's only 1 day recovery time. The ideal cryoablation candidate, the lesion must be visible on ultrasound. A DCIS study is now pending where we might be able to freeze some of these gals if they've had a biopsy and have left a chip in, so we might be able to just freeze the chip in that region and evaluate it that way, which I think is part of what I was sort of thinking about with this early freeze protocol that I came up with. The lesions must be less than 4 centimeters in diameter, and most of the physicians would prefer to have it less than 1.5. The diagnosis must be confirmed by a needle biopsy. They would like to see 3 to 5 millimeters of space between the lesion and the surface of the breast, but if it's a little bit close, sometimes they can float some normal saline in there. Patients who are not good candidates for surgery or have anxiety about surgery or have general anesthesia problems or they're elderly or maybe they have dementia. The patients are also concerned about cosmetics or having surgery on their breast. So cryoablation is FDA approved, and we now have some reimbursement codes, which is 19105, 19499, and a new code that came out in January of 2020, which is 0581T. So here's cryotherapy, the procedures. So this is the office ultrasound with a gloved hand. You can see where you're going. You put a little local anesthesia in. You take a little surgical blade, make a little nick here. Insert the probe. It has a blue button for freeze, a red button for stop. Push the blue button. You have an ice ball forming with the liquid nitrogen that's coming down the probe. You freeze the area 1 centimeter all the way around, then you put a nice warm pack on. You freeze it a second time, another hot pack, and then the lady goes out to lunch 45 minutes later or so, and you put a little dressing on, and off they go, and you've cured her breast cancer. Breast cryoablation, I think, is the new future in breast cancer treatment without surgery, and I now want to talk to you about my early freeze protocol. So I presented my infrared slides that I'm about to show you folks of a woman named Mary pre and post cryoablation. These are the very first thermography images ever done with any cryotherapy patients ever. This is the perfect marriage of thermography and cryoablation. So Laura Ross Paul and I were invited by the Chinese government to present my slides in the early freeze protocol on July 2nd, 2016 at the 5th International Forum on Cancer, Cryotherapy, and Immunotherapy at the Fuda Hospital in the city of Guangzhou, which is formerly Canton, China, to over 200 physicians and international researchers. And our presentation was called the Early Freeze Protocol. And if you want to watch the full protocol, I have this Early Freeze Protocol on my website as a video. So here is Mary, 3 months pre-cryoablation. So you can see this red area here. The tumor is sitting over in this section with blood flow leading up to it. It's over here as well. So she has an infiltrating ductal stage 2 carcinoma, 2 centimeters by 2 centimeters in her left breast, and there was also some dimpling that was happening over this when I first saw her. She also has a 2 degrees Celsius shift over the mass and blood flow leading to this tumor and the vessels that are leading up to it. So then she said, well, this is great. Now I'm going to go off and have my breast cancer frozen. So this is the first time I'd ever heard about this, and she went off to see Peter Littrip in Detroit. So then Mary reappeared 8 months post-cryoablation, and the pointers here are designating this big, soft, mushy mass, which is now 4 centimeters by 6.5 centimeters. But there's no thermal activity in here, and there's no blood flow leading to it, which is really amazing. So this I thought was absolutely fabulous, that it's cold, there's no blood flow, and the spongy mass. So this is sort of the ice ball where it was. And some of the people think that this is maybe where the immune effect is also happening, because your white cells and cytokines go out to try to eat up these dead cells that are in this area. Then Mary reappeared at 2 years post-cryoablation. So the area that we had seen before, which was 4 by 6.5 centimeters, it's now down to 1.5 centimeters of cold, dead scar tissue. It just shrunk way down. So it's just this little bitty bit of scar tissue, cold, inert, really amazing. So since Dr. Littrip was the physician that saw Mary, he also told me that the spongy mass will actually shrink about 80% in size, leaving this little bit of scar tissue. Mary is also following my Proactive Breast Wellness program, and again, the scar tissue is sitting in here, which is the most amazing thing I've ever seen. So here's the MRI halo, and the contrast is lighting up here so you can see an active cancer. The other MRI over here is where the ice ball is, and you can see that there's no activity at all in here, and the cancer is dead. So instead of racing for the cure, let's talk now about prevention as the cure, and how my Proactive Breast Wellness program over the last 16 years has helped literally thousands of women in the Pacific Northwest. So here is a couple images of a woman before the Proactive Breast Wellness program, which is on the top. So this gal is not eating organically. She's eating her typical drive-through McDonald's. She's on too much estradiol and her hormone replacement, not enough progesterone. She was having a host of menopausal symptoms, including insomnia, when I first saw her. So you can see these big open vessels that look sort of like she's been attacked by a bear, and all these spotty things all underneath on this side. This is the same woman a year and a half later on my protocol. So her menopausal symptoms have all cleared up. This is also heart healthy for the Proactive Breast Wellness program. So you can see all these big open vessels here, and now they're just little wispy things. This is totally cleaned up down here. She used to have a 300 cholesterol up on this set. A year and a half later, she's now a 200 cholesterol. Her good cholesterol, or HDL, has improved. Her LDL has dropped 30 points. She's no longer borderline hypothyroid, and her vitamin D levels are optimal, so she's now rarely getting colds. So I really love to be able to see women that, start off like this, and you probably see a lot of women like this in your infrared clinics, but, on the protocol within, 6 months, a year, 18 months, you can really make quite a difference on how you can clean these folks up. So as you can see, the improvement has been really fabulous for the Proactive Breast Wellness Program on thermography images. So now what we'll do is talk a little bit about what the protocol actually includes. So here is a chapter plan of my book, Anti-Estrogenic Diet, Supplements, Acid Alkaline Diet, Power Progesterone, Hormone Balancing, Environmental Toxins, Breast Care, Diagnostic Imaging, and then a brand new chapter on cryoablation, putting it all together with worksheets. It also includes the Waves of Serenity relaxation program that I did while I was studying at the Mind Body Medical Institute under Dr. Benson. So here are some of the things, gals, that you can do. You can start eating organically, change your diet to an all-organic one. Organic fruits and veggies, avoid GMOs by eating organically, which would be great. Avoid flax, hops, soy milk, soy protein, soy energy bars. Miso and tempeh is actually okay. And the other thing I've discovered is that hemp seeds, marijuana, CBD products, I think, are all estrogenic and are making the vascular patterns worse. So I'm now suggesting people avoid that. We now have legalized marijuana down here, and I'm now seeing big changes in infrared scans because of that. The other thing that you gals can do is exercise. Women who are exercising at least a half an hour a day for 5 days a week actually reduce their breast cancer risk by 65%. That's huge. So get out there and walk or do something. Limit alcohol to less than 2 glasses of alcohol a day. If you do more than that, your liver can't get rid of the excess estrogens, and the estrogens keep going round and round. And remember that hops is not so good for beer. Stress management, meditation, power of prayer, reduce your stress and cortisol levels. And this is why I added the Waves of Serenity to this. And also, don't forget sleep. Lots and lots of great sleep, 7 to 8 hours. So if you have disturbed sleep and having hot flashes and whatnot, work with your provider that may need to help you with either exercise, hormone balancing, or magnesium is a great thing to help to reduce hot flashes and also cramps in the middle of the night. Also get these labs done. Check your vitamin D levels. 83% of all cancers can be eliminated if your vitamin D is optimal. The goal here is to get to be 70 to 75 on a 32 to 80 scale, or 80 to 90 on a 30 to 100 scale. So this is really important. All the women with breast cancer are vitamin D deficient and also hypothyroid. And I'm in Oregon. The folks in Canada are even higher on the globe, so you really need to check and get your vitamin Ds optimized. Check your thyroid panels, TSH, free T3, free T4, and if you're hypothyroid, get it optimized as well. Check your hormones, consider progesterone to balance out your estrogen dominance, or just get hormone testing to see what's going on, because you may have an estrogen body burden with estrogen mimickers in your environment, and the thermography camera can help you see that. So what can you do? So here's my new fancy book and also ebook. It comes with an extra 1,000 pages of medically indexed materials to go with it for free, and my Waves of Serenity relaxation program. So this gets me to my end slide, and you folks can contact me if you'd like. This is the phone number in the clinic in Eugene. I also provide my books for your clinic so that you can help the women coming into your thermography clinic, or if you're a surgeon, to help reduce a woman's risk of breast cancer or its reoccurrence. So if you are a technician but really can't counsel people, this book would be a great guide and help the women that come to see you. Or if you're just a gal that would like a nice autographed copy of my book, get a hold of me through my website and I'll send it up to you. And the e-books are also on Amazon and Barnes & Noble, and I actually now have it on 6 international sites. And if you need a cryoablation navigator, this is the way you reach me in this fashion, and I will chat with women from a distance and see if I can help people get to a place to have their breast cancers frozen. And of course, social media is wonderful, so please follow us on Facebook, and I'm very, very grateful for all of you coming to this conference. And if we can promote cryoablation as the future of breast cancer care and the perfect marriage of thermography and cryoablation, I think this is just going to change lives and save breasts. And thank you ever so much, and I'm very grateful that you were able to come here today. Thank you.